We are from Family Planning Association of India, Nagaland branch. Our headquarters is in Mumbai. We are celebrating 75 years anniversary. And since 2023, as per Nagaland branch, since 2023 and 2024, we are venturing, or rather, the correct term would be going into humanitarian response activities as well. As per the name Family Planning Association of India, we work for family planning, and with the passage of time, we realized the importance of sexual reproductive health, and so we have committed ourselves to sexual reproductive health services. And today, this press meet is basically to update the media and the public on the humanitarian response activities that we have been doing. I have a script here. I will read out this one so that I will spend less time. Family Planning Association of India is a pioneer organization in sexual and reproductive health in India, working since 1949 to advance the right to sexual and reproductive health information and services for all. FPA India provides a wide range of services including family planning, HIV prevention, maternal health, and adolescent sexual health education. The global humanitarian crisis displaces about 34,000 each day due to natural hazards, climate change, and armed conflict, epidemics, complex emergencies, etc. Women and girls' need for reproductive health care is not suspended in crisis. 1/4 of people affected by crisis are women and girls aged 15 to 49. 1 in 5 women are likely to be pregnant, and 1 in 5 of all deliveries will experience complications. In crisis settings, there is also a heightened risk of early marriage, rape, and sexual violence, unsafe abortions, unattended births, sexual gender-based violence, and unintended pregnancies. Transmission rates of STIs, including HIV, increase in emergencies. Adolescents may feel fearful, stressed, bored, or ideal. They may find themselves in risky situations that they are not prepared to deal with. Such situations. Very young adolescents, 10 to 14 years, especially girls, are at risk of because of their dependence, lack of power, and their lack of participation in decision-making processes. They may not recognize the sexual nature of abusive, exploitative actions. At this situation, there is urgent need for access to confidential and safe sexual and reproductive health services and referral pathways. In such a situation, there is a breakdown of mechanisms for protection and service delivery. At this situation, there is urgent need for access to confidential and safe sexual reproductive health services and referral pathways. The Family Planning Association of India has played a crucial role in addressing humanitarian crises over the country, across the country. Though its implementation of the Minimum Initial Service Package, MISP, for reproductive health, FPA India has provided vital support to vulnerable populations affected by natural disasters, conflicts, and other emergencies. MISP is an internationally recognized set of priority actions designed to address reproductive health needs during the onset of a humanitarian crisis. It focuses on preventing excess maternal and neonatal mortality, managing sexual violence, and ensuring access to contraception, among other essential services. FPA India has integrated MISP in its emergency response framework, ensuring the continuity of SRH services even in the most challenging situations. In recent years, FPA India has successfully implemented MISP during several critical humanitarian crises. Floods and cyclones in regions hit by severe floods and cyclones such as Kerala, Bhubaneswar, and Odisha. FPA India deployed rapid response teams to ensure that reproductive health services are not disrupted. These services included providing safe delivery kits, ensuring access to contraception, and offering psychosocial support to survivors of gender-based violence. During the unprecedented COVID-19 pandemic, FPA India mobilized its resources to address gaps in SRH services. With the healthcare system under immense strain, the organization ensured access to contraceptives, antenatal care, and essential maternal health services, especially in rural and underserved areas. FPA India has extended its support to communities in conflict affected areas by setting up temporary health camps, providing emergency contraception, and addressing the reproductive health needs of displaced populations in Manipur. To ensure comprehensive SRH services during crisis, FPA India has worked closely with local governments, international partners, and other non-governmental organizations. This collaborative approach has been instrumental in scaling up the MISP initiatives and ensuring a coordinated response to humanitarian emergencies. Additionally, FPA India conducts training for healthcare workers and CSO partners on MISP protocols and empowering local communities to manage SRH services during crisis. As India continues to face natural disasters and humanitarian challenges, Family Planning Association of India remains committed to its mission of ensuring access to life-saving SRH services. By strengthening its partnerships and continuing to prioritize MISP in its emergency response efforts, FPA India is well positioned to meet the reproductive health needs of those affected by future crises. Locally at Nagaland branch here in Kohima, as part of humanitarian response preparedness, we have started conducting many trainings, meetings, and orientations with different stakeholders, besides learning ourselves as well through various trainings conducted by Family Planning Association of India at Mumbai. We have also started observing national and international humanitarian days like World Humanitarian Day, which was on 19 August, Disaster Risk Reduction Day, which falls on 13 October annually, the importance of internationally accepted MISP for sexual reproductive health during disaster or emergencies has been advocated and lobbied with stakeholders at the district level with CMO, DDMA, and CSOs and partner agencies, including media organizations and media personals for sensitization and for general public awareness. More efforts need to be done for wider population and crucially the young population to be aware and skilled to face any eventuality of disaster. While we must be prepared with pre-positioned essentials, like medicines, equipments, and skills to be a resilient society in the face of any disaster. This is why media myths becomes crucial and important to bring about wide publicity and accountability with regard to skills and preparedness.
I'll be addressing on the emergency preparedness plan. The emergency preparedness plan is essential because it ensures that individuals, communities, and organizations are ready to respond swiftly and effectively when disaster strikes. By having a structured plan in place, risk can be minimized, lives can be saved, and the impact of disasters such as natural calamities, pandemics, or accidents can be significantly reduced. Preparedness includes identifying potential hazards, creating communication strategies, organizing resources, and most importantly, outlining clear roles and responsibilities. This helps in reducing confusion, panic, and delays during emergencies, leading to a more coordinated and efficient response. Moreover, emergency preparedness builds resilience. When communities are prepared, they recover faster and are less vulnerable to future risks. It promotes awareness and educates people on how to protect themselves and others, fostering a culture of readiness. Sexual and reproductive health SRH services, along with addressing sexual and gender-based violence, are critical in emergency situations during disasters because vulnerabilities increases significantly during crises. Disasters often disrupt healthcare systems, leaving individuals, especially women, adolescents, and marginalized groups, without access to essential services like contraception, maternal care, and treatment for sexually transmitted infections, STIs. This lack of access can lead to an increased rate of unintended pregnancies, unsafe abortion, and maternal mortality. Providing sexual reproductive health services ensures that people's basic health needs are met, helps prevent life-threatening conditions, and upholds their dignity during difficult times. Additionally, disasters exacerbate conditions that can lead to a rise in sexual gender-based violence, including domestic violence, sexual assault, trafficking, and exploitation. Displacement, overcrowded shelters, lack of law enforcement, and the breakdown of social structures make vulnerable populations, particularly women and girls, more susceptible to violence. Addressing sexual gender-based violence in emergencies through prevention, protection, and response services such as safe spaces, legal assistance, and psychological support is vital to safeguarding their health, rights, and well-being. Integrating sexual reproductive health and gender-based violence in emergency responses not only addresses immediate health risks, but also promotes resilience and recovery for affected communities. Thank you.
Well, that's the scripted part. If you have any questions or any queries, not that we may know everything, but we would like to answer of the things that we do here at the Nagaland branch. While you're thinking of any questions, let me just tell you that Family Planning Association of India's humanitarian response. We are not first responders. The first responders are basically the people from NDMA, SDRF, or all these authorities that are concerned with first response. But when there is an emergency or when there is a disaster, people, normal life is disrupted and people are shifted to camps, relief centers. And with the example of Manipur armed conflict that we have witnessed, it is seen that people live there for months together. And it is this time that sexual reproductive health services are crucial and important for people displaced internally and living in relief centers. And the team that we normally consist of is a doctor, nurses, lab technicians, counselors, and of course volunteers. And there are times when language communication becomes a barrier, so we need interpreters as well. But whenever we conduct health camps, we see to it that confidentiality is maintained, so that each individual, have a private counseling session or OPD session, or even the disbursement of medicines are to be seen as private. Otherwise, many assumptions come, and we can't allow that to come in a relief center as well. So those are the things that we'll have to keep in mind. There are also these principles of neutrality, impartiality, non-political, and being independent. Non-political, neutrality, impartial, and independent. Those are, four principles that we follow when we go to conduct our health camps or sexual reproductive health services with the displaced persons in relief centers. Fortunately, Nagaland is prepared with the kind of exercises, mock drills that we have been observing. But should there be a disaster beyond the control of the society or the mechanisms that is in place, then Family Planning Association of India has the resources to be able to activate its rapid response team within 72 hours. And of course, for that, we have the medicines and consumables pre-positioned already. It's in place. We have staff trained, and we are also working with the CSO and NGOs, youth organizations, even the student bodies, so that the need for volunteers can be handled, because only the medical team cannot work. So we have worked with these organizations also. And many a times, Family Planning Association of India is looked upon as an agency working only in the field of family planning or contraceptives or birth control. But apart from what we do for sexual reproductive health, we also want to, inform that we are prepared for any humanitarian response activities. So these are the things that I wanted to share with you as well. As part of a project, project, that's the humanitarian response project. As part of that, with this media meet, this is the kitna 14th activity that we have done. Just focus on the Spring project. As the branch, we do many other programs as well, but focus on humanitarian response. We want to be able to tell the society and the people in authority that family planning also has resources, trained, capable to handle sexual reproductive health needs of people in emergencies. We also want to tell people and people in authorities that sexual reproductive health services is essential in the emergency crisis situation, and these need to be incorporated. And for that, we are prepared and we have the resources to be able to, would it be the right word to use, complement or supplement, I don't know which, the efforts of the government and the authorities.